Hi, I'm Dr. Athre. I thought it'd be a little interesting for viewers to kind of have a quick insight into how I look at rhinoplasty cases. So I have kind of put together this video in order to give viewers out there, potential patients, and just anybody who has an interest of how I end up looking at patients and examining them from a preoperative analysis standpoint. So this lovely young lady shows up to my office and says, I have always been thinking of a rhinoplasty. She says, I've been thinking about a rhinoplasty for more than 10 or 15 years. Ever since I finished puberty, my nose reached its final position, I've been considering getting a rhinoplasty. So this is kind of how I see her in terms of what to do in my analysis. So the first thing I did is, in my head, I draw a magical vertical line down the face. This is my rough gestalt into, is the face symmetric, is the nose symmetric, and how much deviation that the nose has. The other thing that I like to do is have the patient look up for me and take a look at the view of the nose from the bird's eye view. Here you can clearly see that the patient's septum is bowed out into the patient's right nair. The next thing I like to see is the profile view. The profile view gives an overall shape of the nose, whether there's a dorsal hump, where the takeoff of the nose is, whether there's a supratip break. You can also look at the projection and the rotation of the nose. As I was examining her, a key critical point of the examination is to take a look at the craniometrics of the patient. Craniometrics means where the facial plane is. In her, I felt that her chin was just a little bit recessed, giving the bottom portion of her face felt a little needed something. She was a little too top heavy. So the surgical game plan on this patient was to do a rhinoplasty, take down the dorsal hump, give her a little bit more of a feminine profile, and add a small chin implant just for balance. So here is her pre and post-operative view, approximately 4 weeks after surgery. You can see her post-operative view is straight, but she was pretty straight to start with. The main thing that I see is that the tip definition has definitely improved in her post-operative view. That little nubbin that we used to also see as the septum was deviated into the right side is now gone. Profile view says everything. She has a nice, beautiful feminine profile, and you can see that the chin augmentation is very subtle, just adds a little bit of balance to the bottom third of the face without becoming overbearing or giving her a Jay Leno chin. So as I've said on multiple different videos, the analysis and execution of a surgical plan is probably the most important things in achieving consistent, natural results. Thank you so very much.